Carol Craig, CCC. You have gallstones, but they're not bothering you. Will you still need surgery? No. A lot of people are walking around with gallstones and don't even know it. Sometimes they're found at autopsy. And as long as it's not bothering you, the problem with gallstones is if you get a small gallstone, it can literally get into the tree, the bile ducts, and cause obstruction. And then when the gallbladder contracts, and the gallbladder contracts like a perfume atomizer, it squeezes. When it squeezes, it pushes out bile into your intestines to help digest fat. Well, if you get a tiny stone in there, that can be more of a problem than a large stone. Then you can get a large stone, as long as it's sitting in a spot and not blocking the plumbing outlet, you can walk around with it for the rest of your life. It's not a problem. If it ever gets where it's blocking the plumbing, that's called a ball and valve effect. Then it can block. I mean, you can literally change your position and cause the gallstone to roll away, and then you're fine, and you will get relief from that. I have found that the anti-diarrheal medication Imodium helps with gallstone pain as well. It's one of the things I use to diagnose it. If I have a person that's hurting, I give them that. It relaxes the biliary tree, and will oftentimes give some relief from a gallstone. When that happens, then I know, then I can get x-rays, and there's a diagnostic test called the ERCP, where they literally thread down through your throat into your stomach to get to the biliary tree, which is in the first part of the small intestines. They squirt dye in there and they see if it's blocked or obstructed by a tiny gallstone. A gallstone getting into the biliary tree is called a gallstone ileus. It can be a problem as well. So, but again, if the gallstone's not bothering you, I would wait until it bothers me. Having a gallstone is the condition of cholecystitis. What is it? Cholecystitis is inflammation of cholecystosis. It's condition of you have a gallstone, it's not bothering you, you're not bothering it. As long as you don't eat a lot of high-fat foods, it might not ever bother you. The primary treatment when a person develops symptoms is to limit the amount of fat in the diet, so the gallbladder doesn't have to contract to squeeze out bile to digest fat, and then you walk around with it until. But once it flares up, you have cholecystitis. It's like appendicitis, and then it needs to be surgically removed. Once it's flared up, antibiotics alone is not going to probably give you relief. You're going to have it removed. And so fortunately now they can do that oftentimes through your belly button arthroscopically and not give you that disfiguring abdominal scar that used to be indicative of gallbladder surgery. You'd have a diagonal scar on the right side of your body that was impossible to hide and not too attractive. But now, if you're lucky, you get tiny little incisions that you barely can see. And they can go in and remove even large gallstones. They go in there, capture them, put them in a little basket, pull it out. It's amazing surgery. But that's minimally invasive treatment of gallstones. So that's one of the things you can do.